Hello students, I am Dr. Abhinandan Patil. I am working as an associate professor at Patil College of Pharmacy, Kolhapur. Today we are going to talk in detail about the concept that is called posology. So the today's contents, it contains the definition, the factors affecting the posology, and the most important thing, that is the dose calculations. Objectives: at the end of the lectures, the students will be able to understand the concept of definition, so we can call it as they will know define posology, then the factors which are affecting the posology. They will know about pediatric dose calculation, which is very important. So we'll start with the session. Posology. It is nothing but it is the most important parameter in the case of the pharmacology or in the case of the medical science. It is a science, or we can call it as a part of a medical science which deals with the dose or its quantity, which will give the desired pharmacological action. As in the previous session, we have learned in detail how the pharmacological action is totally related with the concept which is called therapeutic window. And based upon the therapeutic window, we are preparing the dosage form. And these dosage form, with the appropriate dosage related concept, we will able to give the desired pharmacological activity based upon the different disease condition. So in conclusion, what we understand in the term of the posology is, posology, it is a branch of science, that is a medical science, which deals with the dose and its quantity in order to get the desired pharmacological action. Basically, this posology, it is based upon some concepts. The first important, it is a route of administration, and whatever the actions that we are proposing, so it is studied in detail by the pharmacopoeia. So these posology concept, when we talk in detail, so they are related or they are been considered based upon the different factors. So there are many factors which are affecting the posology or indirectly the dose, which includes the age, sex, body weight, route of administration, time of administration, environmental factors, emotional factors, presence of diseases, accumulation, additive effect, antagonism, idiosyncrasy, tolerance, tachyphylaxis, metabolic disturbance. So these are the parameters which purely affect the dose. Indirectly, they are considering the position in which the physiological factors plays an impact in the dose regimen of a particular patient. So again, we'll see what exactly the factors are. These are age, sex, body weight, route of administration, time of administration, environmental factor, emotional factor, presence of disease, accumulation, additive effect, antagonism, idiosyncrasy, tolerance, tachyphylaxis, metabolic disturbance. So we'll see the each individual beat in detail. When we talk about the age, the most important factor in this physiological parameter is the age. The pharmacokinetic parameters of the drug purely they are related to the age. Because when we see the newborn and when we compare it with the adult or even the geriatrics, then the whole pharmacokinetic parameters of the drug and its parameters are changed. For example, when we talk about the newborn infants, they are abnormally sensitive to the certain drugs. Why? What is the reason? There are n number of the reason. When we talk about the anatomy of this newborn, so they have poor digestion. Even the enzyme system is just started its activity. Thus, it has a great influence in the parameter that is elimination. So in conclusion, we understand that the age plays an important role. Similarly, when we try to compare the factors that is seen, that is the pharmacokinetic parameters, then in this case, for the adults, the dose regimens are totally different because whole system, that is the digestive system along with the enzyme system, they are fully active, and because of that the dose regimens are totally different. On contrary, when we talk about the elderly patients, they are quite sensitive to the different types of the drugs. Just will, for example, if we talk about the hypnotics, so the role of the hypnotics in the case of the elderly patient is somewhat quite different. They may require the higher dose because of the regular continuous use of that is a drug, or simultaneously there is a chances that whatever the receptor level activities are there, so they are totally been changed. So age is the first factors which purely related to the physiology. Second point that we want to talk over here is the sex. Basically, the influence of the medicine or the drug or the dosage form, they change not only by the age but also by the gender, or that we call it as a sex. Because we are familiar with the concept, the physiology of men and women, they are totally different. And the major difference is the hormone. Hormone plays an important role in the regular activity in the case of both the genders. The special care should be taken when the drugs are administered, basically in the case of the menstruation, pregnancy and lactation. Thus, what we understand that in these conditions, the role of the medicines are totally different. Just for instance, a strong purgative, for example, aloe, should be avoided during the menstruation. Similarly, the drugs which may stimulate the uterine smooth muscles, such as drastic purgatives, anti-malarial drugs, ergot alkaloids, are contraindicated during the pregnancy. The reason is that they may interfere in the regular trimester activities. It may be the first trimester, second or third trimester of the pregnancy. Other examples are alcohol, barbiturates, narcotic drugs. They also have an impact on the fetus through the placenta. Thus, the another factor which affects the physiology, it is the sex. Third parameter that we are going to discuss over here is the body weight. When we talk about the body weight, the average dose is calculated, or it is mentioned mg per kg weight of the body. For example, in the previous techniques we have seen that the total single dose for the adult, it is ranged between 50 to 100 kg. But according to the physiological concept, it has been calculated as mg per kg. So for example, if a patient is obese, if he or she is a children or a child, or the concerned person or the patient is a malnutrited, so in these cases you can see the impact of the doses, they may vary. Thus, the body weight really plays an important role. How this can be further correlated? We know that there is a concept which is called volume of distribution, which is called VD, that is called volume of distribution. When we talk about the volume of distribution, then there are certain drugs which are lipophilic, certain drugs that are hydrophilic. So based upon that, when we talk about the weight, then definitely the ratio of the different body mass index, it may vary. And thus, whatever the desired effects are there, definitely they are going to change. Thus, what is the conclusion? The conclusion is that body weight also plays an important role. The next important parameter is the route of administration. When we talk about the route of administration, there are various routes. It may be like an oral route, it may be like by the inhalation, it may be by the intravenous, which is called parenteral route. So there are main number of the routes. So when we talk about the IV, that is intravenous, the doses of drugs are usually smaller than the oral. The basic reason is that when we talk about the oral doses, so in the case of the oral doses, the drug has to go through the basic alimentary canal. Then there is the first pass mechanism which is been taken care by the liver, and at the end it goes into the circulatory system, that is a receptor level. But when we talk about the intravenous, they bypass all this system and the desired effect which is expected, it is achieved. Thus, the route of administration also plays a very important role. Intravenous route, this might enhance the chances of drug toxicity. So, this can be considered as a negative part, because you might be familiar with some concept that some of the patient, not we can call it some patient, some of the subject, if they are been bitten by some insects or even by like some reptiles like snake, then you may see that the sudden death is observed. What is the reason? The reason is that whenever any xenobite, which we call as a drug or any foreign material, it enters into your systemic circulation directly into your blood, then the activity or the concept, that is the activity of the concept, it is at the extreme. That means you will get the desired or undesired effect at a very fast rate. Thus, the route of administration plays an important role. So this is one of the example. Simultaneously, there are other route of administration such as inhalers. So inhalation is the part where the inhalers are used. For example, in the case of COPD or the asthma, the patient required a quick action. So for that purpose, if you go for the oral dosage form, then definitely the chances are that the desired effect may the patient get after a particular period of time. Thus, if you want the result to be get in the very short tenure, then in this condition, the inhalations are used, which gives the systematic and simultaneously the local effect which is needed for that particular patient. Next is the time of administration. When we talk about the time of administration, the presence of the food in the stomach, or if you are with the empty stomach, both the condition will play an important role related to the drug. How come? The presence of the food in the stomach, they may delay the absorption of some of the drugs and rapidly been absorbed in the case of some in the empty stomach. So this is one of the important condition. Just like iron, arsenic, cod liver oil should be given after the meal, and antacid drugs, they should be taken before the meal. So there is a two important conditions, that certain drug has to be taken via the empty stomach like antacids, and certain drugs should be taken after the meal in order to prevent the certain side effects which may arise due to that drug, because these drugs along with the food, they are easily been absorbed. So time of administration also plays an important role, and that is the reason whenever you see the prescriptions, in the prescriptions the doctor gives the special recommendation that the desired whatever the medicines which is given, there is a dosage form given to the patient, so they should be taken before or after the meal. Another important factor is the environmental factors. The personality and the behavior of the physician also plays an important role in the case of the drug absorption or in the case of the posology. How come? The reason is very simple. Because when we see a favorable environment where the physician is giving you the medicines, he is giving the medicament with a proper positive approach, then definitely what will happen, the acceptance of the psychological acceptance of the patient increases, and the healing activity starts as soon as he interact with the patient. That is called psychomotoric effect. So just an example, the females are more emotional than the male and they require less dose of certain drugs. So this is what is one of the good example. Another point that can be shared is the placebo effect. Some of the patient, they feel that they have like certain types of physiological issues or pathological issues. In general, we can call it a pathophysiological condition. But the physician will understand that there is certain psychomotric or psychotropic effects or psychosomatic effect. We can rather call it not psychotropic, psychosomatic effect. And in that psychosomatic effect, the placebo are recommended and they give the positive effect. Thus, placebo is nothing but it is the formulation without the API, that is an active pharmaceutical ingredients. It may be a plain excipient, that is a non-drug part. Next part, the factors which may affect the dosage form is the presence of disease. Just for instance, certain drugs like barbiturates, chlorpromazine may produce unusual prolonged effect in the patients having the liver cirrhosis. Just an instant, as I told you that whenever you take certain drugs by oral route, then what happens? This drug has to enter into your alimentary canal and then it goes to your liver for the further activity. But in this condition, when the patient is having the issue with the liver, then what will happen? The liver will be not in the condition to do the metabolism of that particular drug. So what will happen in such condition? The toxicity may precipitate, and this toxicity, when it precipitated, it shows the various types of side effects or rather adverse effect, such as, one example, streptomycins may produce toxic effect on these patients where the kidney function is not working properly. So this is one of the good example. That means the presence of disease, and along with that, what kind of medicines or the medicament you are just prescribing, it also plays a very important or the vital role. And it may change the dose or even the desired to attain the desired pharmacological activity, we may change the dosage form or even the medicine also. Accumulation, another parameter which can be studied in detail. Some drugs, they may produce the toxic effect if it is repeatedly administered for the long period of time. What I'm saying, some drugs may produce the toxic effect if it is repeatedly administered for the particular long period of time. As I previously mentioned, the volume of distribution. Some lipophilic drugs, they have like tendency to get accumulate into the vital organs, and because of that, the condition which occurs, it is called accumulation. And it's very difficult sometimes that it may get eliminated from the body, and this occurs due to the accumulating effect of the drug. This is nothing but is called accumulating effect, where the particular organs are targeted by the particular drugs. Example, digitalis emitting heavy metals. For example, I want to share you one disease that is called Minamata disease, and this has been seen due to the heavy accumulation of the mercury. Another factor which is purely related to the influencing dose is the additive effect. When two or more drugs that are administered together is equivalent to the sum of their individual pharmacological action, the phenomena is called additive effect. For example, the epinephrine and aminophylline in the treatment of bronchial asthma, so they both are playing an equal role. They are showing the same pharmacological activity. Thus, what will happen? They will show additive or additional effect. So this is one of the example. Another is that we can call it as synergism. What is synergism? When a desired therapeutic result needed is difficult to achieve with a single drug, at that time two or more drugs are used in combination for increasing their action. So what I am trying to say, that suppose if you want to achieve a desired pharmacological activity, and in this desired pharmacological activity, so what you are doing, that if you are trying to give two or more drugs, you are trying to give two or more drugs with the same activity, and that this combination, they are increasing the action, that is a desired pharmacological action, then it is called synergism. Example, procaine and adrenaline. Procaine and adrenaline in the combination, they increase the duration of action of procaine. So this is one of the good example of synergism. Next is antagonism. What is the antagonism? It is the opposite effect. It is opposite effect. What do you mean by opposite effect? When the action of one drug is supposed to is opposed. Okay, what I'm trying to say, when the action of one drug is opposed by the another drug on the same physiological system, then it is called drug antagonism. Just as a simple mathematical formulation, we can say 1 minus 1 is equal to 0, or rather, if one of the drug is quite stronger, then we can say 2 minus 1 is equal to 1. The desired effect is reduced, or it may be minimal, or sometimes it may be 0. For example, the use of the antagonistic response to the drug is valuable in the treatment of the poisoning. Because most of the time, if you see there is some kind of poisoning, then the milk of magnesia is given. In which condition? That is, for example, that is called acid poisoning. For the acid poisoning, the milk of magnesia is used. So that means in certain conditions, the antagonism effectives are found very useful to treat some physiological disorders or poisoning condition. So it is one important parameter, and simultaneously the prescriber take care of the patient while prescribing certain drugs where the antagonistic effect should not take place. And if it is occurring, then definitely the patient has to suffer. So it's a moral responsibility of a pharmacist also that while giving the prescription, while checking the prescription, whatever the desired prescription is given, so he may take care that the desired dosage form which has to be given to the patient, so he verifies before it is to be given to the end user. Another important factor, which is a common one, which we call allergy or idiosyncrasy. An extraordinary response to a drug which is different from its characteristic pharmacological action. An extraordinary response to a drug which is different from its characteristic pharmacological action is nothing but it is called idiosyncrasy. For example, aspirin may cause gastric hemorrhage. Aspirin may cause the gastric hemorrhage. It means an unexpected response. Even some xenobite, they show the allergic response in the particular subjects. Some people, they may are allergic to pollen grains that we are calling, they are allergic to certain component, certain drugs, even certain food. And this, it is totally genetical and it vary person to person. It vary person to person. So idiosyncrasy is nothing but we can call it as an allergy, and it is the extraordinary response to a particular drug. Next, we can call it as an tolerance. It is another factor. When an unusual large dose of a drug is required to elicit an ordinary effect, to elicit an effect ordinarily, then this is called tolerance. For example, a particular drug, if it is given for the long period of time, which is called bombarding or to the particular receptor, so in this condition, it may be called as a tolerance. Example, the smokers are tolerant to nicotine. Even the person who are alcoholic, so these people, they are also tolerant to the quantity or the large quantity of the alcohol. So how come they can be categorized? So they can be categorized into two types. First one, that is called true tolerance, and second one, it is called pseudo tolerance. If a particular drug in the form of dosage form, it is taken by the oral or and parenteral route, then it is called true tolerance. On the opposite side, if it is taken by the oral and it is showing the tolerance, then it is called pseudo tolerance. That means a body can become tolerant to any condition or any dose or any dosage form if it is repeatedly bombarded again and again. Next important parameter that we are going to talk, it is tachyphylaxis. When we talk about tachyphylaxis, what exactly mean by tachyphylaxis? When some drugs, they are administered repeatedly at a short interval. So difference between tolerance and tachyphylaxis is that tolerance, it may be for the long interval of time, and tachyphylaxis, it is for the short interval. Then the cell receptors where the desired activity is achieved, it get blocked, and the pharmacological response to that drug, it get decreased. And the decreased response cannot be reversed by increasing the dose. And this is called tachyphylaxis or acute tolerance. So what do you understand the difference between the tolerance and tachyphylaxis? The difference is, when we talk about the tolerance, then the tolerance is purely related when the particular drug, it is used for the long period of time or for the long interval, and suddenly if you administer the same drug at the short interval of time, then what will happen? The receptor will get blocked, and once the receptor will get blocked, then definitely that drug, if you try to give again, so the phenomena, that means it will reverse the action. The desired response will not get reversed, or it will not get the desired response, and it is called acute tolerance or also called as tachyphylaxis. The good example is ephedrine. If it has been administered for the continuous mode for like asthmatic attack, for example, initially you may feel that the patient is getting comfort, but later on it will show the reverse activity. The patient will not feel the desired pharmacological activity, and thus it has to be stopped. And this is nothing but we can call it as a tachyphylaxis. Next important factor, that is a metabolic disturbance. What do you mean by metabolic disturbance? For an instant, suppose if a patient or the subject is having some biological issues which includes dysentery, diarrhea or some other pathophysiological condition. So in this condition, what will happen? There is a change in water balance or water electrolyte balance and acid balance. Even there may be the change in the body temperature and other physiological parameters or the factors they may get changed or they get modified. How come these things are happening? Due to the use of a particular drug or dosage. Now again I'm going to revise the thing, that change in the water electrolyte balance and acid balance, body temperature and other physiological factors may modify the effect of the drug. That means in the case of a normal patient, what means, you may be feeling that what exactly mean by the normal patient. For instance, if a patient is having some like pathophysiological issues, if you are giving the drug which is appropriately showing the desired pharmacological activity, so it get hamper if it is been having a change or the deflection in certain characteristics like water balance, body temperature or physiological factors, and the desired pharmacological activity which is to be expected, it will be changed. Just an example, salicylic acid, it will reduce the body temperature with the condition of partisan limited. What do you mean by the limited? For an instant, suppose if a patient is having a body temperature, there is a rise in the body temperature, is having a fever. So by taking the salicylates, you can see that body temperature, it is reduced, it is brought up to the normal. But if the same salicylate, if it is given to a normal individual, then you can't claim that, or you will not say that the body temperature will reduce below the current one. So that means it is called as a limited effect. This is a good example of the metabolic disturbance. Another important factor is that, as I mentioned, in the case of the diarrhea and dysentery, the same thing may happen. That means the xenobites, drugs, food, medicine, all the properties which is showing the activity, it will get changed. Now we'll turn into the next important part, that is the calculation of the doses. The doses are also calculated, because basically when we go into a pharmacy shop or the chemist shop, what we see that appropriate doses are already available. We just go with the prescription, and based off the prescription we take the medicines. But if you see how these doses are calculated, so these doses are calculated by certain formulas which is purely based upon the age, body weight and the surface area of the patient, and accordingly the posology, that means the dose or the desired dose, is been prescribed. So what I'm trying to say, already it is available in the market, but simultaneously if you want to count it, appropriate dose which is needed to the particular subject or the patient, so these parameters are calculated. So let's see what exactly are the different formulas which will help us to get the dose. And basically these doses are given for the children by calculating it with the adult dose. The dose appropriate to the age. There are a number of methods by which the dose for the child can be calculated. For example, the Young's formula. What the Young formula says, this formula is used for calculating the dose for the children under 12 years of age. So what is the formula? A dose of a child is nothing but it is equal to the age in years of a particular adult divided by age in years plus 12 into the adult dose. Again I will repeat, the dose for the child is nothing but the age in years of the particular infant divided by the age in years plus 12 into the adult dose. So for this purpose you should be thorough with the adult dose. and you should know the age of that particular child. If you are thorough with the age of the particular child, then definitely the dose for the children can be calculated. There are other formulas for the age between 4 to 12. This is called Dilling's formula. If a child is between the age 4 to 20, we can call it as a child or even the adult also. So the dose can be calculated in as a age in years of the particular dose divided by 20 into the adult dose. That means the dose for the child is equal to age of that particular child divided by 20 into the adult dose. Another formula is there which is called Fred's formula. In this, the calculation is done for the dose in between that is 0 days to 2 years. We can call it as an infant to 2 years. So the dose for the infants is equal to age in months divided by 150 into adult dose. Another formula that is called Cowling's formula. The dose for the child, it can be calculated as age at next birthday in year into adult dose divided by 24, or in the simple way we can say that dose for the child is equal to age at the next birthday divided by 24 into adult dose. Another formula that is a Clark's formula. The dose for the child is equal to, it is based upon the weight, that is a weight divided by 70 into adult dose. So these are the various formulas which will help to understand the concept how the calculations for the pediatric dose is carried out. So what exactly we studied or we understand, and what is the summary that what the student understand is the posology. What do you mean by the posology? How it is correlated with the therapeutic effect? What do you mean by the therapeutic window? So that already I explained you previously. Along with that, you understand what are the different factors which are playing an important role or which are affecting the posology. The dose calculation methods, as we have gone through the different formulas like Young's formula, Cowling's formula, Dilling's formula. So these formulas will help you to understand how to calculate the pediatric dose. So this is the overall summary of the today's lecture. So students, what is the assignment for you? So today's assignment is, first one, you should define the posology. You should define the posology. Second, you have to give the factors which is affecting the posology. For instance, suppose if the question is asked for the long answer, like for 10 marks, then you should give all the factors, at least 10 factors which is responsible or which are playing an important role in the dose calculation. So these are the factors. And the last one, you should explain the pediatric dose calculation with some examples. What are the expected examples? That is the different formulas that we have gone through with Young's formula till Clark's formula. So thus, this is the in general concept that we learned about the posology, the factors and those calculations. So just go through the assignment, complete it. Best wishes. Thank you.